Hello and good afternoon, everyone. This is Dr. Ali Atiq. I'm head of the Department of Pharmacology and Toxicology, Faculty of Pharmacy, Mahasa University, Malaysia. Now, we have met before and we are meeting one more time. And the reason is same. We have brought you a very interesting webinar today. And today, with us, we have Mr. Kader. Mr. Kader is a pharmacist, and he's a registered pharmacist with a background in a clinical pharmacy. He graduated from University of Cyberjaya. He has expertise in clinical therapeutics for the respiratory system and the geriatric population. Currently, he's handling the hospital attachment for the underground and the diploma pharmacy students, and he's going to share his thoughts on the role of the pharmacy assistant in the communal well-being. So, without further ado, sir, welcome, sir.
Okay, thank you, Dr. Ali. So, hello everyone. So, I am Mr. Kade. So, today we are going to see what are the roles of pharmacy assistant in the communal well-being. So, let me just open the slides. All right. So, we are going to see the roles and responsibilities of pharmacy assistant. So, a pharmacy assistant is a person who graduates from diploma in pharmacy. So, in Malaysia, we have a few institutions, including Mahasa. So, if you graduate diploma in pharmacy, so obviously you are going to become the pharmacy assistant. So, as an introduction, so pharmacists. Okay, so pharmacy technician or pharmacy assistant is going to work together with pharmacists. So it's not that the pharmacist will be your boss. So usually the pharmacist will rely on those two, which is pharmacy technicians or pharmacy assistants, because they are also called as pharmacy aides, because you need to handle the operations, because pharmacy is not just a one-man job. If you are working in the hospital, so per day it can be like 1,000 patients coming in. So you should have a few staff so to help you to ease all the dispensing. So other than that, pharmacy assistant or pharmacy technician, they will handle the day-to-day operation. So pharmacists can devote their time to patient care services and also pharmaceutical questions. So obviously, if the patient is at your pharmacy counter, other than receiving the medication, so sometimes patient would like to ask you a few questions. So this will be more focused on pharmacies. It's not that pharmacy assistant or pharmacy technicians can't do that, but usually in hospital setting, they focus on pharmacists doing on the pharmaceutical questions or having a session of Q&A with the patient. So since we know that just now we have seen pharmacy assistant and also pharmacy technician. So what is actually the difference between them? So pharmacy technician is more advanced in terms of their clinical responsibilities than pharmacy assistants. So they also perform the clerical duties such as handling the transaction, stocking shelves, and answering phone calls. So it's the same like pharmacy assistant. So another point, in the United States, so pharmacy technician are to become licensed. So the difference between pharmacy technician and pharmacy assistant is that pharmacy technician do have their own special license, and this is only as per my knowledge. In United States only practice the use of this term pharmacy technician as they have this program that has been accredited by the American Society of Health System Pharmacists, ASHP, or the accreditation of Council of Pharmacy Education. So it's sort of that pharmacy technician is the pharmacist in United States, because they can do the work as like a pharmacist to compare with your pharmacy assistant. Okay, so to see in our nature, which is Malaysia, so pharmacy assistant in Malaysia, so they are also known as pembantu pegawai pharmacy. So if you are working in the hospital setting, hospital government setting, so once you graduate from your diploma in pharmacy, so you will straightly go into the hospital and you will get the title of UF 29. So that is your role in the hospital as a pembantu pegawai pharmacy. So mostly they will help to do the pharmacy duties except prescribing medication to the patient. So in Malaysia, prescribing of medication mostly is being done by the specialists and the doctors. So there are a few places that pharmacy assistant can go or work after you finish your program. So first one is government hospital. So these are a few of examples that I have put there. So one of it is Hospital Kuala Lumpur. We also have Hospital Putrajaya. So anywhere in the region, so you can work. So next one is private hospital. So we have example there, Prince Court Medical Center and Pantai Hospital. And lastly, actually, pharmacy assistant also can work in the community pharmacy. So the most famous or the most commonly heard will be Guardian and Watson. So these are a few general tasks of a pharmacy assistant. So first one is dispense medicines to the patient. So if you were asking what is dispense, that is the action when you are at the pharmacy counter. So the pharmacist or the pharmacy assistant is telling you information and they are giving you the medication. So that particular act is called as dispense. So second one is assemble medicines for prescriptions. So prescriptions is a paper where the doctor will write the medication that you need or that the patient need, and they will have your details, the doctor's signature, doctor details, and then they will, that's why you are going to bring like one paper to the pharmacy. So that is the prescription. So once you have the prescription, so the pharmacy assistant will take the prescription and will start to fill up your medicine. So they are taking medicine from the bin. Let's say you are going to take tablet paracetamol, so they are going to put in the small envelope and label your name and the instruction on how to consume the paracetamol. So number three will be manage areas of medicine supply such as the dispensaries. So other than filling up medicine, so you should take care of the areas. It should be tidy. Okay, it should be neat. So number four is supervise other staff working in the pharmacy. So this one is mostly for community pharmacy. Since community pharmacy, we also have like sales reps or sales assistant. Okay, and then we have the next one, produce medicine in hospitals. So there are certain time if the medication is not available as liquid preparation. Okay, if we maybe pediatric patients, so kids or children that need to use syrup. So the available preparation is only tablet. So we are going to break the tablet and mix with syrup. So that is meant by produce medicine in hospital, for example. And the last one is provide information to patient or customer. So why they are patient and customer? Because in hospital or in clinics, we are going to use the term patient. But in your pharmacy, let's say you are going to open up a pharmacy one day, so all the person that is coming into your shop, we are going to call them as a customer. So let's look at the first one, hospital setting. So we have government hospital and private hospital. So in the hospital, actually we have a few departments. So we have the outpatient pharmacy, inpatient, Galenical, clinical, and store. So these are the departments that the pharmacy assistant can work in. So this is your outpatient pharmacy actually. So you are going to take, first of all, you are going to take your queue number. So once you take your queue number, you will pass your prescription. So then the pharmacy assistant will start to fill up the prescription according to your disease, okay, or that the doctor has diagnosed you. Maybe you have hypertension or you have diabetes, so they are going to fill up for you. So once the medication has been filled up, so the pharmacist will sort of counter check whether the medication given it is correct or not. Okay, so there are cases where errors can happen. So that's why this particular step should be there. So counter checking. So to make sure that the medication is safe to the patient, so it's not like underdose or even overdose that can lead to toxicity. So other than filling up medication, so pharmacy assistant can also actually sit at the front table. As you can see, there are three staffs there. So you can dispense to the patient. Okay, maybe you have your own duty roster. Maybe you need to work maybe only on Mondays for dispensing, because we have a few staffs to dispense throughout the week and throughout the day. So other than dispensing, filling up the medication, you can also do like the preparation of medication, which is the extemporaneous compounding, we call it. So if a baby comes to your counter, so the baby needs to use syrup, and the preparation available is only tablet. So you are going to break the tablet, mix it with syrup, and then you are going to dispense to the patient and let them know how to eat the medication and how to store it. So this is another example of the outpatient pharmacy. Okay, so you can see there are a few bins. So the red bean, the yellow beans, so all of them are being filled with medication. So they are being categorized maybe according to the system and also according to the dosage form available. Okay, moving on to the next one, next department, which is your inpatient pharmacy. So outpatient pharmacy is usually located the same level as your clinic. Okay, inpatient pharmacy usually it will be one ground lower. So inpatient pharmacy is the place that you are going to provide medication to wards. So if you are being admitted to the hospital, the source of your medication is actually coming from this inpatient pharmacy. So inpatient pharmacy still you have the same layout. You have the blue bin, the red beans. Okay, so inside them we have medication. So some medication might be a little bigger, so they are placed directly onto the shelf. So this is injections, which is in front of this lady. So if you can see, there are two trolleys. So this trolley can be found inside the ward. So this one is the pharmacy assistant, if you would like to know. So if you are going to work in the government setting, so usually you are going to wear the gray shirt. So gray shirt will be the pharmacy assistant. So other than filling up medication, so this is the place that you are going to fill up the medication and send back to the ward. So usually nurses will send this trolley, and then you are going to put in according to the bed. So each drawer, we have the patient's name and the patient's bed. So you are going to place the medication, and then once it's ready, so the nurse can collect it back. So moving on to the next one, the next department, Galenical. So Galenical is mostly preparing the medicine. Okay, if you can see point number one, preparation of internal and external medication. So internal medication can be your cough syrup. Okay, it can be also syrup ferrous, or it is being used to patients who have low blood. Okay, just to boost up back their RBC, red blood cells. Okay, external preparations or external medication can be any type of wash is potassium permanganate, which is in the purple color, so that is considered as external medication preparation. So number two, other than preparing, so you are going to do procurement and ordering. So usually Galenical, they are going to order from the big store. So there will be a main store in the hospital. So every single department, inpatient, outpatient, even now we are going to look at Galenical, all those procurement will be coming directly from the main store. Okay, so number three is sending samples for lab analysis. So once, let's say you are done with doing your cough syrup inside the Galenical department, so you can give the medication directly to the patient, or you are going to store it. So you are going to put it in a different area. Okay, because you are going to test, maybe you are going to take one bottle and then to send for sampling just to check is there any microbes present or is there any contaminants. So once the lab has analyzed, they have mentioned no issues, so you can use the prepared cough syrup to the patient. So that is number three. So number four is pre-packing and labeling. Okay, in some cases, um, store is going to be buying bulk preparation. Maybe they are buying cream, so the cream is available in 1 kilogram size. Okay, the packing maybe like a big bottle of 1 kilogram, so you are just going to pack into a smaller bottles like 30 grams. So these are considered as pre-packing, so you are packing it into a smaller size, and then you should label according to the expiry date. Okay, so that is the purpose of labeling. So you should have the name of medication and the expiry and the how to store. So next one is distribution to other pharmacy department. So once you have prepared, so obviously only two departments are going to use. So first one will be your outpatient pharmacy and then inpatient. So it depends how much outpatient is ordering from you cough syrup. So if it's 20, so once it is ready, so you are going to send to outpatient. So next one is preparing floor stock item for wards. So floor stock is where you can use the item, so because the item is available at the ward. So you don't need to order for now and then, because every day you should order from the pharmacy if you are in need to use that particular medicine. But floor stock is we are going to give in, not to say bulk, but in a larger amount, and then you will keep it at the ward. So in case of emergency, so for example, if the patient suddenly have fever, so you can just give tablet paracetamol. So that is considered as floor stock item. So last one is sterilization and maintaining cleanliness of equipment. So once you are done with preparing the cough syrup just now, so you should clean it properly and sterilize it just to make sure there is no microbial growth and you can easily use for the next preparation. So these are a few example of the Galenical preparation. So on your left is they are preparing cream. Okay, you are using the mixer, and then on your right there are a few syrups. So we have the chloral hydrate. Okay, and then also we have the, if I'm not mistaken, that one is a cough syrup, which is the second from left. Okay, so next one is the clinical services. So we are done with three. So this is the fourth one. So under clinical services, we have TPN, we have TDM and CDR. So TPN, so you can see all these people working in the jumpsuit. So they have a special area. So it's a control area. So TPN, you are preparing the bag. Usually you can see in the ward, the bag is maybe colorless or sometimes it's quite white. So inside the bag, it is having all the nutrition that is needed by the patient. So you are going to assist the pharmacist in terms of preparing the bag, because every single day there will be a patient needing the TPN bag. So next one is TDM, therapeutic drug monitoring. So for TDM, usually pharmacy assistant, they are going to assist in terms of preparing the serum and then putting in the machine. So once the result is out, it will be passed back to the pharmacist for calculation. So TDM is just to calculate or measure whether your dose given by the doctor, prescribed by the doctor, is sufficient or it is subtherapeutic or is it overdose. And the last one is cytotoxic drug reconstitution, CDR. So CDR is the picture in the middle. So since CDR is quite harmful or dangerous, so they are going to work in a special cabinet. So this particular special cabinet is different from your TPN. So CDR is if you are a pharmacy assistant, so if you are working in CDR, so you will get special allowance. Okay, so last one will be store. So if you are working in stores, so procurement of item from logistics. So one of the main supplier for government hospitals is Pharmaniaga Berhad. So you are going to procure items from Pharmaniaga just to make sure that all the departments in that particular hospital can receive sufficient amount throughout the year or the month. So second one is carrying out stock verification. So after you have procure or you have buy the items from Pharmaniaga, so you need to check whether it is okay in terms of the expiry. Okay, is it enough in terms of the stock? So number three, management of stock availability and usage prediction. So throughout the month or throughout the year, so you should have this statistic. So if you have this particular statistic, you will know how much that you are going to purchase again the following month. Okay, we can just purchase based on our own instinct. So next one is making emergency order requests in case of emergency outside working hour. So maybe there are a few medication that is not in your drug list and somehow the specialist has ordered because there is a special case from a special patient. Okay, so moving on to the next one, which is your community pharmacy. So there are a few roles and responsibilities. Actually, if you are working in community pharmacy, to compare if you are working in hospital environment is not much of the different. The difference is in community it will be like you are in a shop, obviously. If you are in the hospital, the difference is you have more departments. In community, you only have one. So community, what are your roles? So first one is answering medication question over the phone or in person. So there are cases, maybe the patient has bought medicine from you, medication from you. So they would like to know what are the extra information, maybe in terms of storage. Maybe they have forgotten the points that you have told them during dispense. So they are going to call you. Okay, so second one, stocking over-the-counter medication. So over-the-counter, what does it mean? So over-the-counter is those medication that you can get from the gondola that have all around the pharmacy. For example, your Panadol, your patch, okay, maybe your shampoo. So all those are placed on the gondola. But the over-the-counter medication is your Panadol. So you can get maybe your constipation medication. Okay, so there are a few more. So you can go around the pharmacy just to check what are the over-the-counter medication. So those medication doesn't need the prescription. Okay, so you can just buy it. So third one is packaging and labeling prescription medication. So there are cases where people will buy you medication that they have brought you the prescription. Maybe there is a clinic next to your place. So the doctor said, okay, please take the medication next door, which is your pharmacy. So they are going to give you the prescription. So you are going to prepare like if you are working in the hospital. It's the same thing. So number four, entering patient information and prescription in the system. So this is crucial. Once you have prepared the prescription, so all the details of the patient you should keep in your system because the pharmacy enforcement team somehow they will check what type of medication that you have prescribed to the patient. Okay, so not all medication that you can prescribe easily to the patient. So number five is placing orders for stock to maintain inventory. So you are going to call the suppliers. So it depends on your pharmacy. Sometimes the pharmacist will do it. Sometimes the assistant pharmacist will do it. Okay, and the last one is accepting payment for prescription. Obviously, this is the cashier's role. So these are a few examples of the community pharmacy setup. So this is what I meant about the gondola on your right hand side. So they are placing, I guess this is shampoo. Okay, so in the middle, they will also have maybe over-the-counter medicine. So on your left, sometimes they put it as your supplement. So you can get your multivitamin, your fish oil, your vitamin C. Okay, this is the cabinet behind the pharmacy's counter. So you can't assistant pharmacists can easily give medication to patient. Only the pharmacist can do it. Okay, so these are considered as control medication. So by that, so I end the presentation. So back to you, Dr. Ali.
Thank you so much, Mr. Kader. It was a very informative presentation because being a pharmacist, I didn't even know that the pharmacy technician have role in community pharmacy, in the hospital, and in the other places as well. So it was very informative, of course. Now, there are few questions which I want to ask, one of which would be
Okay.
that. Of course, there are different places in the community they are serving. So do you have different module or courses where you equip with the information with your students or the our viewers if they want to be part of this assistant pharmacy fraternity? Do you have the right course for them and also the areas for them to practice?
Mm, okay, Dr. Ali. Can I just rephrase your question? Means the assistant pharmacists do have like their own um, short course just to understand the pharmacy better, is it?
Yeah. This is one thing. Means
Okay.
do your department offer any course for that? And apart from that, for example, they are serving in hospital. They are also
Okay.
working in community. So do you
Okay.
have the places for them to practice all this before
Okay.
they go into the community?
All right, understood. Thank you so much, Dr. Ali. So for if you are entering diploma in pharmacy in Masa, actually we are giving you chance. We are
Hmm.
preparing, one of it is master class. So if you are interested in going into community pharmacy, so there is a course that you can attend how to open up a community pharmacy. So it is
That's
being taught, yeah, yeah, it's quite interesting. It's being taught by a pharmacist, which is our own lecturer. She has been in the
Mhm.
community pharmacy for 20 years.
Oh wow, that's a lot of
Yeah,
experience we are
yeah,
talking about.
yeah. She
All
opened
right.
her
Thank
own,
you.
so you can gain
Okay.
from that. I think.
All right. Thank you so much, Mr. Kadir, for your time and, of course, for
All right,
sharing your knowledge. Thank you so much. Viewers, we will definitely meet each other next time with a new webinar. I hope you have enjoyed. Thank you so much and see you soon.